we have Dr. Sanjukta with us, who is treating Shammo, not only Shammo, many other SMA patients who are now dealing with either type 1, 2, 3. So she is one of the pioneers who is dealing with SMA, not only in our country, however, throughout the globe. Thank you, ma'am, for connecting with us. So, ma'am, could you please tell us that what is SMA and what is the revocation and how it could be treated?
As you know, you're dealing with Shammo being his mother from day one. So SMA is a neuromuscular condition. So it is a genetic condition which is inherited. And what happens is there is a deficiency of a particular protein that is made by a particular gene. So essentially what happens is that protein is lacking in the child's body. And in this case, the SMN1 protein that is lacking in all SMA patients varies in the amount it is lacking, depending on how much of the gene is defective. To put it in a very simple way. So what happens is the children with SMA, depending on the amount of protein that is lacking, they present at different stages in life. In Shammo's case, he presented very early, and that is known as SMA type 1, which is one of the severest form, where the protein is nearly about absent, and the other protein, the type 2, cannot take over to that extent. So the children, what happens, they are very soft to touch, they are floppy, their neck holding is not good, or they never learn to neck hold, they can't sit, they cannot carry the weight of their head. All this is manifested as the child is a few months old, and they are the non-sitters. Like in Shammo's case, he has not been able to sit independently, or even with support, his head tends to fall back. So this is what SMA essentially is, and it varies according to types. But if I am going to concentrate on Shammo, because you're Shammo's mother, is type 1, which is one of the severest forms, and we need to treat early, treat quickly, treat effectively. So what are the treatments available and why they should be treated? Because one is that there are now disease modifying agents available. So along with physiotherapy and the correct drugs, Shammo could make very good progress. Also, they are developmentally normal from the brain point of view. They are absolutely like any other normal baby, smiling, understanding, their IQs are very good. So if we give them the correct support, they can go to school, learn things, become a productive member of society.
Correct.
It's a battle that can benefit society and him and all of us.
Correct.
So that is important. So it's not a thing where he doesn't have any quality of life. He has a quality of life because his brain is active, but his muscles are giving away. So we need to make sure his muscles don't give way, because what happens, as you know, he is now admitted, and this is because his respiratory muscles are weak. They end up having respiratory infections. And when they have respiratory infections, it's very difficult to cure them because they cannot cough, they cannot take out the phlegm, so it tends to turn into pneumonia. So with disease modifying therapy, we can give them the chance to survive, do well in life. So the medications that are available for Shammo at this stage are the oral variant risdiplam, which can be given daily, but it is lifelong. And in their case, maybe not as effective in the other types of milder forms of SMA. Though it shows some amount of improvement, but what we are looking for, if we can manage to give it to him, is the gene therapy, where the defective gene is replaced by means of a medicine which is one time only, given as an IV. We have discussed this before. This is our plan for his future. It has to be given when he is well, when he is off oxygen, not needing any ventilatory support. So it should be given as quickly as possible. If he deteriorates and goes on ventilatory support, this medicine is not going to work that way.
Correct.
So we have to give it to him before he deteriorates further. He is doing okay in spite of the respiratory infection now, and we have to continue to see that we try to give the medicine to him as soon as possible for maximum effect.
Correct.
And this is the gene therapy or the onasemogene abiparvovec or Zolgensma, as you know, the lifeline for SMA children, especially like Shamu.
Thank you so much, ma'am, for your insight. Just last question, because we like SMA parents, or because the awareness is so less in society, they're supposed to ask that if you will give the medicine, the child doesn't have any future. So, I just want you to share some insight about it, that if we would be able tomorrow by God's grace to gather the amount and he will be giving, we will be getting the medicine, then, can he be in the mainstream of life, or what it is?
The thing is that, as I have said, their brain is intact in spite of what their body goes through. So when the brain is intact, as you've seen in great people, even if they're wheelchair bound, they can do great things.
I was reading about Stephen Fleming. Yes. Stephen Hawking. Correct.
Yes. So that is what he had is a variant of a neuromuscular disease, not so dissimilar from Shamu, but obviously presenting in a later age and in a different gene.
Correct.
But the effect is as much, that it deteriorates to such an extent that they're wheelchair bound, and you can see that even though he couldn't talk, couldn't eat, his brain was active. With physical activities going, but we may not contribute anything to society.
True.
So we can never go to his level. So it's all a matter of opinion. But for all SMA children, medicines do work. These medicines are used worldwide, and nobody, especially in countries where the government is funding, in very rich countries like UK and US, where you get this medicine through insurance or through the NHS or the government system, they would not be applying this medicine if they was not having any effect.
Correct.
So everything is obviously, any medicine is given when it has the correct and desired effect, and of course the child has a fighting chance, good chances of survival, and good effect at the end of the day. It is just not the medicine is expensive, just use it and it's
for research and development purpose.
This is way beyond research and development. It is FDA approved. It is approved in all parts of the world. But yes, it has not come to India yet. It has to be imported. Specifically, I think because the cost of the medicine for the DCGI, the drug control of General of India, has allowed us to use this medicine when we import it in small quantities for specific patients. So obviously he is satisfied that this medicine, the authorities are satisfied that this medicine has a fighting chance.
Good. Thank you so much, ma'am, and thank you everyone. I would really like to thank ma'am, because she's so busy, but she has given us some time. So I would request through ma'am, not only for Shamu, but whosoever is fighting this rare disease, where mom and dad, especially like me, the parents, where she has been a ray of hope or light, please trust them and help them to get Zolgensma. And to the people who are there in chairs, specifically for our country, it's time that we should try to change something to give a better chance in life to all these SMA kids, because as ma'am mentioned, that they are absolutely normal by brain and their IQ is absolutely normal and probably better, I was reading through. So they could be some asset for society too. Thank you so much, ma'am, for all your work.
Thank you.